Our presentation today is about the radiological anatomy of the skull and the facial bones. And the first is to know what is the function of the bony part of the skull. To provide protection of the inner part, that is to say the brain and the part of the orbital part. Also to provide anchor for the tendinous attachment for the muscle and tendons of the face and the scalp. Also as the bony part to provide fixation of the distance between the two eyes. So it will allow to single stereoscopic vision. Also by providing fixation of the site of the ear, it will allow to localization and of a precise distance and the direction of the sound. The skull bone is covered by periosteum. Externally, it is called pericranium, which is continuous with the loose connective tissue at the sutures. While internally, it is called the endosteum. The endosteum forms part of the outer layer of the dura. Here's more details. We see the dura mater composed of two layers. The periosteal layer, which is the outer layer, which is composed from the inner periosteum, that is to say the endosteum, while the other part is the meningeal part. The skull bones composed of two layers of compact bones. Between them, there is a diploic space. Within this diploic space, there is large valveless veins known as the diploic veins. This diploic veins forms communication between the meningeal veins, the dural veins, and the external veins of the scalp. And here is an X-ray in which demonstrated the two layers of compact bone, the inner and outer tables of the skull. Now we will start with the classification of the skull bones. This classification is for simplification and demonstration. The first part of the bony skull is said to be the neurocranium. The neurocranium is composed of two parts. The upper part is the calvaria, and the lower part is the skull base, or sometimes said to be basicranium. The other part is the viscerocranium. The viscerocranium is the facial bones. As we know, the skull composed of 22 bones. These bones attached to each other by fibrous joints known as sutures. All the bones of the skull are immobile because it's attached by sutures, except the mandible, which is a mobile part within the skull. The facial bones, for further simplification, is divided into two parts, either midline single bone or paired bilateral bone. We will start with the single midline bones. The first one is the mandible. The mandible composed of a single curved part within the midline named the body. This is the body of the mandible. While there is two lateral rami, each ramus attached to the body by nearly right angle to form the angle of the mandible. Also, there is three processes within the mandible. The first one is the alveolar process. The alveolar process bears the teeth of the lower jaw. The other process is the condylar process, which articulates at the temporomandibular joint. And the other one is coronoid process, which is separated from the condylar process by the mandibular notch. We say that the angle between the ramus and the body of the mandible nearly right angle to form 90 degrees. While here in the infant mandible, because of lacking of teeth, it is a lesser angle, of a greater angle, I'm sorry. Now we will start with the vomer. The vomer is nearly a triangular bone, lies within the midline of the nose, separate the two nasal cavities. It forms the posterior inferior part of the nasal septum, of the bony nasal septum. This part grooved on each side by the sphenopalatine nerve and vessel. And here we see demonstration for the sphenopalatine or nasopalatine nerve. It is the same name. Here's more demonstration. We see that the vomer form the posterior inferior part of the nasal septum while the other part is formed by the perpendicular plate of ethmoid, and the remaining part is cartilaginous. Now we will go to the palatine bone. Palatine bone, it is a difficult bone because in order to understand it, we need to see it in multiple views. This is a lateral view. We see the palatine bone, which is an L-shaped bone. If we want to imagine it in a frontal view, this is a frontal view of the skull. The palatine bone lies here, and this we see it is an L-shaped, formed from a horizontal part and a perpendicular part. Here's the perpendicular part is demonstrated. We see that this is the perpendicular part, and superior to it, there is a small area known as Pterygopalatine Fossa, in which the palatine bone forms a small contribution to it. Also, it contributes to small part in within the orbital bone. While if we see it from the inferior plane, we will see that it forms posterior part of the hard palate, which play a role in the separation of the oral cavity from the nasal cavity. So it forms part of the roof of the oral cavity and part of the floor of the nasal cavity. And here's the Pterygopalatine Fossa, in which we say that the palatine bone forms a small contribution to it, and we see that it contains the pterygopalatine ganglion and also transmit maxillary nerve and vessel. The other, we will start now with the paired bilateral bones. The paired bilateral bones, the nasal bone forms from two lateral bones joined in the midline to form the nasal ridge. They are bounded laterally by the frontal process of maxillary bone. They also form an anchor for the cartilaginous part of the nose. And here lateral skull X-ray, in which we see the nasal bone. Now we will start with the lacrimal bone. The lacrimal bone forms part of the anterior medial part of the orbital cavity. When we study the palatine bone, we say that it forms a small contribution to the orbital cavity. And we can now see this is the small contribution for the palatine bone. So the tip of the palatine bone will welded in the orbital cavity to form part of its structure. We will now go to the turbinate. The turbinate is a long curled bones that project into the nasal cavities. The middle and superior turbinates or concha are part of the ethmoid bone, while the inferior turbinate, the paired inferior conchae, are separate bones. We see here it is the inferior turbinate is a separate bone that is attached to the palatine bone and to the maxillary bone. It is the largest turbinate, and it is covered by pseudo-stratified columnar respiratory epithelium that is play a role in the direction, heating, and humidification of the air that is entered into the nose. Now we will go to the maxillary bone. The maxillary bone forms the middle part of the anterior view of the face. It is formed from two bones united at the midline. It forms part of the lateral, it forms part of the floor of the orbital cavity, and also it forms part of the lateral and the inferior wall of the nasal cavity. Also, it is by its articulation with the by its continuation with the part of the palatine bone, which forms the hard palate. The hard palate separates the oral cavity from the nasal cavity. It has the four processes: the frontal process of the maxillary bone, the zygomatic process of the maxillary bone, and the alveolar process. While if we want to see the fourth process, it is best demonstrated by the lateral projection, which is named the palatine process of the maxillary bone. The zygomatic bone, also known as the malar bone, because it forms the prominence of the cheek. It has two processes: the superior process, known as the frontal process of the zygomatic bone, which articulate with the zygomatic process of the frontal bone, while it has a posterior process which articulate with the zygomatic process of temporal bone to form the zygomatic arch. Now we will go to the bones of the calvarium. The first bony part of the calvarium is the frontal bone. The frontal bone forms from two bones that united to each other in the midline. Later in life, this suture will fuses to form a single bone. The frontal bone attached to the parietal bone by the coronal suture. This suture in the midline known as the metopic suture. It is usually obliterated by the age of 9 to 12 months of life. If the suture not obliterate, if the suture not obliterate and remains to the future life, it will name to be persistent metopic suture. Usually it is of little clinical significance, but it may be misinterpreted as a frontal skull fracture and usually associated with the frontal sinus hypoplasia. And we can see it as a radiolucent line surrounded by marginal sclerosis. And in case of a trauma, and if this information is not kept in mind, it may be misinterpreted as a skull fracture. This if not obliterated. While in converse, if it obliterate too early, this will lead to a metopic suture synostosis. And this abnormal fusion will prevent the lateral growth, of the frontal bone and will result in abnormal triangular appearance of the front of the skull, which is known as trigonocephaly. Also, this may be associated with ethmoid sinus hypoplasia and orbital hypothyroidism, which is abnormal closeness of the eyes. The second part in the calvaria is the parietal bone. The parietal bone forms much of the calvaria and forms from two bones united in the midline by the sagittal suture and attached to the frontal bone by the coronal suture and posteriorly to the occipital bone by the lambdoid suture. On the posterior of the parietal bone, near the midline and near the lambdoid suture, there is the parietal foramina, which is a paired foramina found posteriorly on the parietal bone. This foramina transmits the emissary veins from the sagittal sinus. But in certain circumstances may be too prominent to be visible on a skull radiograph and named to be a prominent parietal foramina. This usually of little clinical significance, but may be associated with cortical and venous malformations and sometimes associated with certain syndromes. Here is another view for the giant parietal foramina. The temporal bone, here is an area related to the parietal bone known as the pterion. The area of pterion, it is an H-shaped area formed by the fusion of multiple bones, which is the frontal bone, the parietal bone, the temporal bone, and the sphenoid bone. These four bones, when fused together, they form this H-shaped area. It is of a clinical significance because it is the weakest area in the human skull. So it is easily fractured. And other clinical significance is that the anterior part of middle meningeal artery pass behind this area, as demonstrated here. And if this area fractured, it may lead to epidural hematoma. Now we will start with the bones of the skull base. The first one is the ethmoid. The ethmoid composed of four parts. The first part is the perpendicular plate of ethmoid bone and its superior continuation known as the crista galli. The second part is the cribriform plate of ethmoid. The cribriform plate of ethmoid sits in the anterior cranial fossa between the two eyes and at the roof of the nasal cavity, in which the olfactory bulb rests, and it is pierced by multiple olfactory nerves to convey the smell sensation from the nasal cavity to the brain. Also, the third and fourth part is the two lateral masses known as ethmoidal labyrinth, in which there is the ethmoidal air cells. Now the sphenoid, composed of body and two lateral wings, greater and lesser wing. The body contains the sphenoidal air cell. Here we see the sphenoid air cell. The body contains the sphenoid air cell, and anteriorly within the body there is the pituitary fossa or sella torsica. On each side of the pituitary fossa there is the carotid sulcus, in which the carotid artery run, and with this fossa it is accommodate for pituitary gland. Anteriorly to this fossa there is an elevation known as tuberculum silli. Anterior to the tuberculum silli there is an optic groove for the accommodation of optic chiasm, while on each side of the tuberculum silli there is the two processes known as the anterior clinoid processes, while posteriorly there is an elevation known as dorsum silli, and on each side of the dorsum silli there is two lateral processes known as posterior clinoid processes. The dorsum silli continuous posteriorly with the to form the clevus toward the foramen magnum. The lower part of the sella torsica, known as the lamina dura, which is a thin bone that may be eroded by pituitary tumor. And here is a lateral view of the sphenoid bone, in which we see the sphenoid air cells. There is a variant morphology of the sella torsica. The sella torsica, usually on the lateral skull X-ray, we see it as a U shape because it has two projections, which is the anterior, which is known as the tuberculum silli, and posterior, known as dorsum silli. If the anterior part of the U-shaped removed, this will lead to J-shaped, known as it is present in multiple differential diagnoses, maybe as an anatomical variant, especially in children, or it may be associated with the mucopolysaccharidosis, as in this case, in which the diagnosis is mucopolysaccharidosis. The temporal bone, it consists of four parts: the squamous part, which form part of the skull vault, and the second is the pyramidal petrous part, in which it contains the middle and inner ear. It is a very strong part of the human skull, and also the aerated mastoid and the inferior process known as the styloid process. Now we will go to the occipital bone. The occipital bone continues anteriorly with the dorsum silli in the clevus, and this clevus leads to the foramen magnum, which forms part of the communication between the structures inside the brain and the spinal canal. It also attaches to the multiple bones. Here we see its attachment to the temporal bone, to the parietal bone, and to the sphenoid bone. It has inferior process known as condylar process. This process articulates with the C1 to form the joint in which there is a movement limit to the anterior flexion, extension, and there is no rotation on this joint. Now we will go to some important spots. Here we see the cribriform plate of ethmoid bone, and in the midline there is the crista galli. This is the anterior part of the sella torsica known as the tuberculum silli, and this is the dorsum silli. Also, this is a petrous part of temporal bone. and this is the foramen magnum. Number one is the sagittal suture. Number two is the frontal sinus. And we will go to spot 3, which is the zygomatic-frontal suture that is attached between the zygomatic process of a frontal bone and the frontal process of zygomatic bone. Also, we see the superior and inferior projection from the ethmoid bone, which is the crista galli and perpendicular plate of ethmoid bone. While in the nasal cavity, we see the nasal septum, and lateral to it, there is the ethmoid air cells. Within the orbital cavity, there is important 3 spots, which is the number 8 is the superior orbital fissure. Number 9 is the innominate line, which represent the greater wing of sphenoid bone, while the number 10 is the lesser wing of sphenoid bone. The number 11 and number 12 is the petrous ridge and maxillary sinus. Here we see in the number 13 is the inferior nasal turbinate, and then the mastoid process, while the inferior part of the occipital bone seen in the number 15. The last one is the odontoid process or dens of atlas, which is seen here in the number 16. And this, in the lateral skull X-ray here, we see important landmarks within the suture, which is number 1 is the brygma. Now we will describe it in detail. And number 3 is the lambda. This is the anterior and posterior fontanelles. Number 2 is the coronal suture, while number 4 and 5 is the inner and outer table of the human skull. Number 6 is the external auditory meatus. Here now we see the styloid process. Now we will go to the pituitary fossa because it is importantly demonstrated in the lateral projection, in which we see the tuberculum cilli, dorsum cilli, and the sella torsica itself. Also, there is the heart palate and some spots related to the mandibular bone, in which we see the neck of the mandible and the temporomandibular joint. And here we see the frontal sinus, the sphenoid sinus, and the posterior ethmoid sinus or posterior ethmoid air cells. The fontanelles, in which we see it in the previous slide, are a membranous part within the bone, the skull of the newborn. It is formed from the fusion or join of multiple edges of the skull bones, in which it allows the growth of the fetal skull over the developing brain. They have clinical and radiological significance. The clinical significance, in which they used to monitor intracranial pressure, as they elevated if there is an increased intracranial pressure, and used to assess the volume status of the baby as they depressed in dehydration or volume loss. While radiologically it is used as a window for the pediatric brain ultrasound. There is 2 important palpable fontanelles. The anterior one, known as the anterior one, which is the brygma, in which it is usually fuses at the age of 18 to 24 years to 24 months of age, while the posterior one, known as the lambda, which is fuses at the age of 3 months. Here in the number 9, we see multiple small bones. We see multiple small bones within the lambdoid suture. This bone known as the Vormium Bones. The Vormium Bones are small systemoid bones that lies within the lambdoid suture. Usually, if they 1, 2, 3, or 4, or even 5, they have no clinical significance, and it is considered as a normal variant. But if they exceed the number 5, they may be associated with certain diseases or syndromes such as pycnodysostoses, osteogenesis imperfecta, Down syndrome, or other differential diagnoses. And here is the demonstration of Vormium bones. Now we will go to rapid assessment. العفو أستاذ الأسسمنت
عقيل. اوكي يلا هسه نختار نور محمد جواد.
اي نعم استاذ. sagittal suture.
هذا السجيتال سويتشر. احمد خليل. احمد خليل نمبر 2. جازان.
Frontal sinus.
فرونتال. احمد خليل مو ويانا. دكتور زيد نمبر 3.
نعم أستاذ. كريستا قالي.
كريستا قالي. اللي تعود الاي بون هاي الكريستا قالي؟
الإثمويد بون.
اثمويد. اوكي. دكتورة مريم نمبر 4.
Number 4 ethmoid air cells.
اثمويد ارسلز. اوكي. رقم 5 دعاء سعد.
inferior nasal turbinate.
inferior nasal turbinate. هاي شديد. نمبر 6 عندنا نور بابا علي.
Mastoid process.
mastoid process. رايت. استاذ محمد.
استاذ قاعد وياك.
يلا كمل انت وياهم. شكرا.
يلا. لا نصير لا رقم 1.
دكتور برجما.
عمر موجود. عمر فهمي 2.
نعم أستاذ. كورونال سوتشر.
كورونال سوتشر. علي حسين رقم 3. علي حسين.
نعم. الأوكسيبيتال بون.
لا اللاند مارك مو قال لك هو اللاند مارك 3 لاند ماركس.
نعم أستاذ.
فهي اللمدة. زين. سالي عبد الرضا رقم 4. سالي. صفا شامل.
temporal mandibular joint.
رقم 4 ضاعيها. رقم 4.
سلة تورسيكي دكتور. Pituitary Fossa. Pituitary Fossa.
نعم. سلة تورسيكا وبيتوتري فوسا. زين. رنين رقم 5.
نعم أستاذ. TM joint.
TM joint. زين. بعدك عندنا
لاست سلايد استاذ.
اي
اكو بس هذا السلايد.
وينه؟
This is the last one.
هذا هم بيكويز؟
اي last one.
زين بيكويز. منو بعد عندنا؟ نور محمد الجواد.
اي نعم استاذ. coronal suture.
كورونا سوتشر رقم 1. زين. احمد خليل. احمد خليل. احمد خليل ويانا؟ زين. محمد مهدي. محمد مهدي.
دكتور نعم.
رقم 2 عندنا عقيل لو بس 1. وين 2؟
اي هذا بلي استاذ.
هذا 2 اللي اشرتك عليه بالدائره. محمد.
العفو. اللامده.
لا هذا
هذا سويتشر. هذا
سويتشر لك على السويتشر ابني.
لامدو سويتشر.
لامدو سويتشر. خوش. محمد فرحان رقم 3 هاي فوق.
نعم أستاذ. ساجيتال سوتشر أستاذ؟
ساجيتال.
لا
صحيح ساجيتال سوتشر. ليش تخاف؟
تمام.
هاي بالامتحان ما تقوم تخاف.
واضح أستاذ.
رقم 4 ليندا ويانا.
نعم أستاذ. الورميوم بونز.
فورميوم بون. بعد عندنا شيء عقيل لغاية
5 أستاذ.
رقم 5 سالي إذا سمعينا. سالي صوت ما أعطيه يمكن. زين. كازان.
لامدا. نعم.
رقم 5
لامدا.
نعم.
هاي لاست وان أستاذ.
كاتبها لامبا انت عقيل.
إيه العفو أستاذ، أصحح إن شاء الله.
خنساء رقم 6.
اكو بعد؟
هاي
خنساء.
لاست.
بتروي.
ها؟ تيريون.
تيريون.
تيريون.